Have you ever felt physical symptoms in your body that doctors couldn't fully explain? Chronic pain, fatigue, stomach issues, tightness in your chest, headaches, dizziness, numbness, exhaustion. And maybe test after test you were told that everything looks normal, but your body does not feel normal. Today, I want to talk about something that is often misunderstood, deeply stigmatized, and very real. That's somatic symptom disorder and the connection between emotional distress, trauma, stress, and the body. Because your symptoms are not fake, your body is communicating something to you. And especially for Black women, many of us have lived in survival mode for so long that our bodies are often carrying what our minds were forced to suppress. Somatic symptom disorder, sometimes called SSD, is a mental health condition where a person experiences real physical symptoms that create significant stress and disruption in daily life. The symptoms may or may not have a clear medical explanation. That part is important because this does not mean that it's all in your head or you're pretending or you're crazy or that nothing is wrong. It means the nervous system, stress response, your emotions, trauma history, and body are deeply interconnected. The word somatic simply means related to the body. So when we talk about somatic symptoms, we're talking about how emotional or psychological distress can physically manifest in the body. Many people have heard the phrase or the book, "The Body Keeps the Score." And clinically, we understand that trauma, chronic stress, grief, anxiety, fear, hypervigilance, suppression, and emotional overwhelm can absolutely impact the body physiologically. Stress is not just emotional, stress is biological as well. When the nervous system stays activated for long periods of time, the body can begin functioning as though danger is present. This can impact your digestion, sleep, inflammation, immune functioning, muscle tension, cortisol levels, heart rate, chronic pain pathways, and hormonal regulation. The body is not separate from the mind. They are oftentimes communicating. As a licensed psychotherapist, I especially want to speak to Black women here. Many Black women have been conditioned to suppress their emotions, remain strong, push through exhaustion, ignore pain, caring for everyone else, and disconnected from their own bodies. And over time, chronic survival can become embodied, meaning that the nervous system may no longer know what safety feels like. Sometimes anxiety shows up as chest tightness, racing heart, dizziness, nausea, and sometimes grief shows up as fatigue, body pain, heaviness, headaches. And then sometimes trauma shows up as gut issues, chronic tension, dissociation, panic symptoms, immune flare-ups, nervous system dysregulation. And unfortunately, Black women are also often medically dismissed, undertreated, or labeled before being deeply listened to. So this conversation requires nuance because, yes, medical conditions must always be ruled out appropriately. But we must also recognize that emotional suffering lives in the body too. One of the most harmful misconceptions is that somatic disorders mean someone is making things up. That is not accurate. The pain is real. The exhaustion is real. The symptoms are real. I remember working in a psychiatric emergency department. We were located directly across from a hospital, which an emergency room was connected to it. When women would come into this emergency room reporting things that were occurring for them somatically, they were provided tests medical conditions were ruled out, and then they were sent over to the psych emergency department. So there's where I got most of my experience in learning about somatic occurrences within women, and also where race mattered, if there were more black women being sent over to that psych ED versus more white women, and so on and so forth. So the things that I'm sharing, this is not just textbook information. This is from actual experience. That being said, the nervous system can create very real physical experiences. If embarrassment can make your face flush, if fear can make your heart race, if anxiety can upset your stomach, then we already know that emotions affect the body physically. Somatic symptoms are not weakness. They are often signs of a dysregulated nervous system carrying too much for too long. There are many possible contributors: unresolved trauma, chronic stress, anxiety disorders, depression, attachment wounds, emotional suppression, medical trauma, hypervigilance, burnout, and nervous system dysregulation. Sometimes people become highly focused on bodily sensations because their nervous system is constantly scanning for danger. This is not attention seeking. This is survival on a physiological level. The body learns patterns, and when the nervous system has lived in fear, unpredictability, or overwhelm, the body may become extremely sensitive to sensations and stress. A trauma-informed approach does not dismiss medical care. Instead, it asks, what else may the body be holding? And healing often requires both medical support and psychological support. This can include therapy, somatic therapy, nervous system regulation, mindfulness, trauma work, stress reduction, movement, sleep support, boundaries, emotional processing, and body awareness. The goal is not to shame the body. The goal is to reconnect with it compassionately. Within my softness framework, one of the first pillars is safety, because many people are trying to heal in bodies that still feel unsafe. Healing is not just cognitive, it is embodied. Sometimes the work is learning how to slow down, how to notice your body, to rest without guilt, to feel emotions safely, learning how to stop abandoning yourself, and listening to your body without fear. Your body may not be betraying you. It may be trying to protect you the only way it knows how. If you've been struggling with symptoms that leave you feeling confused, exhausted, dismissed, or afraid, I want you to know this, that you deserve compassionate and holistic care. Your pain matters, your body matters, and healing is not about blaming yourself for symptoms. It's about understanding the deep connection between the nervous system, the mind, the body, and your lived experience. And maybe for the first time in a long time, learning that your body is not the enemy. It's just communicating. So thank you for watching today's video. I look forward to seeing you all in the next one. And until then, take great care.